This is Mark Kettering and Matt Partlow. We're continuing our conversation that we started a few weeks back and posted a initial, as we call it, the trial. For those that haven't seen that yet, it is available on Facebook at Matt's account and mine. Matt has been dealing for the last 5 or 6 years with multiple myeloma and has gone through a harrowing experience. And please watch the first part to hear all about that. Today, we're going to continue the conversation and catch up with Matt and see what's going on with his journey with this multiple myeloma. So with that, hi, Matt.
Good morning.
Yeah. So why don't we just start with catching up with you? How are you feeling and what's happening with your disease?
Well, I have to say that the myeloma is back, and it came back in a new form, if you will, and discovering that was kind of interesting. I spent 14 hours in an emergency room and met with 5 doctors on that day to figure out what on earth was going on. Now, if you've seen the first episode, you know I did CAR T, which is an experiment that was truly remarkable because, again, I went from being incredibly sick to not sick with regard to the myeloma in a 2-week period. Now, the side effects of that treatment lasted for a couple months, actually, but that was truly a break from standard chemotherapy. And even to this day, I'm way ahead of where I was last September.
That's great news.
Yeah. So now tomorrow, I will start screening for another trial. This one's being done at Swedish Hospital, and it's a trial that really started on humans in March of 2020, so just a few months ago.
So how are you feeling? I mean, and how did you discover that the myeloma was back?
Well, like a lot of cancer patients, I have a port. I don't know if you can see it through my T-shirt. Right. I call this the manhole cover to my heart. This is, if you're mainlining, this is where you want to go. Coincidentally, I had something crop up right on top of that port. And when you have cancer like I do, typically you have varying degrees of a suppressed immune system. And so if something looks a little odd with regard to a port, like maybe it's infected, that's a 3-alarm fire for me. It's something you can't mess with because you certainly don't want to get a blood infection. So unlike most people, I went to the emergency room on a Saturday, and rightfully so. And there I did a number of things that an emergency room would do, checking. The oddity was it looked like an infection, but I had no temperature and it wasn't tender. So when you looked at this thing called a plasmacytoma, which is multiple myeloma plasma cells collecting on the soft tissue just under your skin.
Wow.
So the thing that's misleading is you'd think something's wrong with this port. But now, and this is a theory, that because you have an incision and there's this port there, there's a bit of inflammation. And what they believe, this isn't proven, is that a plasmacytoma is apt to form where there's inflammation. And so I had doctor after doctor after doctor take a look at this, and we did, CT scans, and the radiologist would come back and go, I don't know why. I can't identify what this is. Now, of course, they know me. It's almost like going into Cheers. Hi, Matt, at the emergency room. I'm kidding, but practically. And
Almost.
so, yeah, they see my medical record and know that I have multiple myeloma. So ultimately, after being there for literally 14 hours, an oncologist came down and said, "Look, I can't prove this scientifically. I'm taking a guess right now. I think it's a plasmacytoma." And I said, "Well, if it is, that means the myeloma's back." And he says,
Uh,
"Well, listen, we'll get test results back on Monday. We'll send them over to your oncologist, give them a call, get the feedback from them when we know what this is. I think it's what it is, but I don't know." So basically, the emergency room came to, here's what we do know. This is not an emergency. Like, they were planning for emergency surgery because they thought we have to take this thing out and clean up this infection. And so the a lot of debate back and forth. But anyway, that's how I discovered that the myeloma was back. And by the way, when they did the blood draw and then later we did a bone marrow biopsy, they came up negative. And
mhm.
so basically what had happened after CAR T was that the myeloma had evolved, if you will, or mutated. Now, on one hand, having this occur in soft tissue just under the skin makes it very treatable with things like radiation, which we did. Um, on the other hand, it's dangerous because this is the type of thing that can metastasize on your liver or somewhere else.
Because it's in your blood, right?
Well, yes, but
And I mean, that's the way it would travel through to another part of your body.
well, in this case, you'd have this collection of these malignant plasma cells collecting
Right.
in your
Right.
soft tissue, which is not how the myeloma had behaved for all of the years prior.
Wow.
And so, what can happen is you, as I understand it, you might have an organ adjacent to where this collection is, and then there's this process that is, uh, you know, it kind of can turn into liver cancer, or kidney problems, or so on. And so you got to be very careful with that.
Oh, right.
And so we got back into what doctors call the danger. We're in trouble here. But I've been in trouble for 2 years. And so I'm kind of accustomed to this, and I understand the disease for a layperson fairly well. And I know what doctors understand about it. So I'm not that concerned. I mean, I probably should be because I'm going to go into a trial that has
Right.
just started, but uh, and we can go deeper into that. It's kind of exciting stuff because there's all kinds of trials going on all over the world. And sure enough, right in my backyard, there's a trial that my oncologist really likes for me.
Ah,
And so that there's other CAR T trials and so on and so forth. We were in touch with what is it? The USF, University of San Francisco
right.
Medical School. They're doing a CAR T study, which is similar to what I did before, but modified.
Yeah.
And it's specifically for people who have already done some form of CAR T. Um, but the one that my oncologist likes better for me is just down the street from the SCCA at Swedish Hospital in Seattle.
Uh, well, we can we can talk more about that in our next
Yeah,
section.
yeah.
But I'm very sorry that it has come back again. But you clearly have a good attitude about it, and sounds like you're under good care. Why don't we sign off this section,
Sure.
and we'll pick up in our next section. We'll talk about what this trial is going to be and
Sure.
what kind of outcome you expect it to have for you.
All right. I'll look
That
forward to
sounds
that.
good. Okay,
All right.
we'll talk next.
Thanks.
Thanks.
Thanks, Mark.